explaining here, I will take everything out and put it on the table so you can also see on the table. We have the female reproductive system here on this model, and we have the male reproductive system. Let's see if this is going to fit in here. It fits perfectly well, so maybe it was designed this way. Anyways, all the organs in the female reproductive system have their analogies in the male reproductive system, so the names of the organs are different, but the number is the same, so we have everything over there. The female reproductive system is more complicated in case of the syntypy of the organs, the position of the organs inside the pelvis. When you first start to orientate, you should look for the promontorium, which is the most prominent part of the sacral bone, and always be very careful for the common iliac vein. Normally it is bigger than the artery, with a very thin wall and very close to the ovaries and the fallopian tubes. If there is some pathology in this area, for example a big cyst or a tumor, it is very dangerous to remove this from the vein, because if the vein ruptures, the blood loss will be dramatic and very fast, and it's very difficult to stop that. So every time you are manipulating with the ovaries and the tubes, be very careful about this vessel. What else we can see? The guts now are removed, so we can see inside, but here on the bottom, in brown you can see, in gray maybe, and brown you can see the wall and the lumen of the rectum. The sigmoid gut is removed, and you can see the rectum. In front of the rectum you have the retrouterine space, and then you have the uterus, and here this fold is marking the retrovesicular space. In front of this we should have the urinary vesicle, and behind this we have the uterus. You can see the fallopian tubes curved like this, and the fimbri of the tubular uterini pointing towards the ovary. So this will be the ovary. I'll take it out in a moment so we can see. This will be the fimbri, this is the ampulla, and this part is called intramural part or isthmus, where the tube is smallest, the lumen of the tube is smallest. Also you can see with blue, light blue, you can see some of the ligaments that are holding these organs in place. They have the same name now like the connections for the guts. It's called mesouterus, meso ovary, and they are mainly built from the latum, ligamentum latum uteri, ligamentum mesouteri is the whole thing. Ligamentum latum uteri, ligamentum teres uteri over here, the yellow structure over here, which travels through the inguinal canal and attaches to the pubic bone, tubo-ovarian ligament, and tubo-uterine ligament, which are holding these things together. This will be for the musculus erectus abdominis, and these dots here will be for the epigastric arteries and veins. So normally we don't have that many space in the body. The body does not accommodate for empty spaces, but here it is made so we can access better, and also this is where the sigmoid intestine should fit in. Now we remove it and have a look outside. Here you can see the teres ligament better. This should be part of the ligamentum latum. This will be the levator ani muscle on the anodiaphragm. This will be part of the transverse muscle of the perineum. This is called the fossa ischiorectalis over here to the side. This is the rectum, this is the muscle of the rectum, and this is fossa ischiorectalis. This is the ischium bone, and this will be the pubic bone. In this direction we explained so far, but you can see better the ovaries now. This is the same, so we open the uterus first. You can see the spiral arteries of the uterus. there should be also glands here in the wall, and this is the epithelial layer. The lumen has a pear-like appearance, more triangular, and here on the bottom should be the cervix of the uterus and the beginning of the vagina. Here you go. This little hill over here we can see for the cervix of the uterus, and this will be the space in the vagina. This is the wall of the vagina. We don't have bones here. I don't know what these yellow structures are. These should be just spaces. This is the space between the rectum and the vagina, and this is the space between the vagina and the urinary vesicle. You can see very thick wall with a lot of folds inside. This will be the small labia, and this yellow thing here will be the clitoris. This is the venous plexus above the clitoris, and here this will be the musculus bulbo-lateralis. This will be symphysis pubica. And what else can we see over here? This will be the musculus anococcygeus, and this will be the musculus transversus perinei, profundus and superficialis. Okay, on the side you can also see the ovary. Let's go to the male reproductive system. The fossa ischio-rectalis is very well visible over here to the side of the rectum. We said it's called rectum, although it has a spiral shape. Apart from this, we can see a very big structure in pink here. This is the prostate gland, which is analogical to the uterus. And on the Okay, let's start the explanation on this plastic model for the human body. We have removed almost all the internal organs. We will also remove this part of the kidney so we can explain a little bit inside. And we will start from the head, and you can see on this side, this will be the digastric muscle. This is the posterior body, and this is the anterior body. This will be the myofibroid muscle, and here you see some of the muscles on the tongue. Between them you can see the sublingual gland. Yes, salivatory gland, the submandibular salivatory gland, and here you can see the muscles on the pharynx. This artery will be the mandibular artery. This will be the maxillary artery, which is one of the final branches of the external carotid artery, together with the superficial temporal artery. And here deep inside you can see the internal carotid artery. Vena jugularis interna with the common carotid artery is positioned here, and you can see the blood supply for the larynx over here, and for the thyroid gland we have 3 thyroid arteries supplying blood to the thyroid gland. The thyroid bone underneath the membrane, the thyroid membrane, the thyroid cartilage, membrana conoidea, and here you have the cricoid cartilage. Between the cricoid cartilage and the thyroid cartilage you have musculus cricothyroideus. What else do we have on the neck? You can use these structures to point some of the triangles on the neck. If you make the middle line, and over here this will be the trigone musculare, the one that is most to the middle. This will be the trachea, and this muscle you can see it is attached, maybe this should be the first rib, so this should be musculus scalenus anterior. The muscle that is traveling on the neck, this is all that is left of this. This will be the musculus omohyoideus, which is traveling and attaching on the scapula. And this big pink area here will be for the musculus sternocleidomastoideus, because it is attached to the mastoid processus. Inside, we will not go inside the head, we'll go next to the chest. Here you can see some of the muscles that are building the muscles surrounding the hip joint, and this will be the big and the small pectoral muscle. Underneath you will see the muscle on the chest wall, and this will be part of the intercostal muscles. The muscles here are not presented very well because you can see only the parietal sheath of the pleura. The parietal shield is removed in this area, so you can see between the ribs, and you can see the vein, the artery, and nervus intercostalis. And these yellow points over here, they are modeling the truncus sympathicus with the sympathetic ganglions. Another thing that you can see very well here is vena hemiazygos and vena azygos. And over here you can see ductus thoracicus, which is not very well visible on our body. The esophagus should be over here, just behind the trachea, but it is cut. Now, another thing that gives you some difficulties, the openings on the diaphragm. This is the right dome, and this is the left dome of the diaphragm. And here you have the center, which is basically a tendon, center tendineus. Inside the center, you start with the opening for the vena cava inferior, and next to it you will have the opening for the esophagus. This is where the esophagus should pass. What is missing, a very important structures that are missing from this model, are nervus vagus and nervus phrenicus. The nervus vagus should travel with the esophagus, and nervus phrenicus should travel with arteria thoracica interna and touch here on the top of the diaphragm. Also, I don't see the diaphragmatic arteries, but we have two pairs, the superior and inferior diaphragm arteries, which are the last pair branch for the thoracic abdominal aorta and the first pair branch from the abdominal aorta, so they should be placed over here. Maybe we can draw them with the marker at some point. And then we have the abdominal aorta placed to the left, the vena cava inferior placed to the right, and underneath and between them on the bottom there should be the beginning. Here around the first lumbar vertebra should be the beginning of ductus thoracicus. The lymph nodes and the lymph vessels here are painted in green. Another important thing, the renal veins. You can see the renal arteries not so well because they are positioned behind them, but what you can see interestingly here is the inferior suprarenal artery and the suprarenal vein. Normally we should also have middle suprarenal artery coming from the aorta and superior suprarenal artery coming from arteria diaphragmatica inferior. Another interesting vessel, this vein traveling with this artery, this will be either the testicle or the ovary vessels, and you can see the gonad arteries. They are paired branch that comes out of the aorta very high. This will be the inferior mesenteric artery, and they should come above it. They are very long, and there is a reason why we have this structure done in this way. Also, the right vein, the right ovary vein, will attach directly to the vena cava inferior. However, the left one will normally attach to the vena renalis, because otherwise it will have to cross the aorta and makes its path too long. The ureter is passing on the front of musculus iliopsoas. This is musculus psoas major, this is musculus iliacus, and this is musculus psoas minor, which are building the common body of the musculus iliopsoas. Also over here you can see the iliac crest, where the musculus quadratus lumborum is